Hi, welcome to the Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, Aaron Bitter. Aaron is a licensed master social worker, licensed chemical dependency counselor, Juris Doctor, and program director at Symetria, Louisville Outpatient Rehab and Suboxone Clinic in Texas. Welcome to the Addiction Recovery Place podcast, Aaron. It's great to have you join me today.
Thank you very much for having me, Chris.
No, really appreciate your time. I know you're incredibly busy. So just going to start at the first question. Can you tell us about yourself and how you became the program director at Symetria Recovery?
Absolutely. Thank you. I am I'm a person in long-term recovery myself from addiction. I've been in long-term recovery since March 7th, 2012. And what that means is after about 21 years of active substance use, I've made changes in my life and found a way to live that's allowed me to be a productive member of society today. I went back to school in my mid-30s. I had previously been a lawyer prior to working in this field. And, unfortunately, part of what addiction took from me was the practice of law. Unfortunately, in recovery, I was able to go back to school, become a licensed chemical dependency counselor, become a licensed master social worker, become a father, which is most important. I've got a 6.5-year-old boy who's everything in my life today. And 10 years to the day of starting recovery. So March 7th, 2022, 10 years after my recovery date, I took the job here as the program director of Symetria Recovery in Louisville, Texas.
Goodness me. Well, first of all, congratulations on everything you've achieved in quite a short space of time as well. And you've certainly been on a journey from being a lawyer, and now you're now the program director as well. So no, big congratulations to you. And thank you for telling us that story. That's just amazing. We're going to talk about your service. So can you tell us about the team that you have and some of their roles, please?
Yeah. We've got a great team. One of the things I like about Symetria is it really truly is a holistic approach. And I feel like that is a term that sometimes is bandied about. And, what does that mean? Well, here, what that looks like, we've got physicians. So we've got, doctor on staff, both in-house doctor as well as doctors that we work with in a virtual setting if necessary. We've got nurses on staff, and our nurses here, we're really fortunate to have a pair of nurses that have worked in this field, behavioral health, for quite a while, extensive experience. We've got an administrative person who's kind of like the face of our clinic, the first person you see, and someone that is an indispensable part of making that connection with people the first time they walk through the door. Of course, we have counselors in Texas. Requires to do this sort of work a license to do chemical dependency counseling. And so we have 3 full-time counselors on our staff, all bring in, various backgrounds, but quite a bit of experience between the 3 of them, collective experience in addiction and behavioral health. And then myself as program director, I do some counseling as well. But as we grow, my role is more oversight of the clinic at large. So we also offer psychotherapy. We do that through virtual at this point, where we've got psychiatrists that we work with, trained in addiction, who are able to work with any of our patients. So they might not be physically in the clinic, but they're available, to serve our patients.
And how long has the service been running for?
So we've been open in Texas since 2018, at least at our clinic here in Louisville. And our clinic is one of 7 in Texas. There's 4 in the Dallas-Fort Worth area, Louisville, Arlington, Fort Worth, and Hurst. Then there's one in College Station, where Texas A&M University is. Then 2 in the Houston area. We also have 6 clinics in Illinois, and those have been around a little longer. Those actually were originally part of an entity called Soft Landings. And they've been around about 15 years, right at 15 years. So the Illinois clinics are a little more established than in terms of time in operation.
Okay. And so what programs do you run at your service, and how do they work? How does someone get referred to you? And
Yeah, I mean, so we're an outpatient medication assisted treatment clinic, and what that means would be that we treat people for opioid use disorder and alcohol use disorder primarily, although we do treat other substances. We utilize methadone, Suboxone. Is primarily medications that we work with for individuals with opioid use disorder. We also have an intensive outpatient program, and so somebody could be in that group regardless of specific substance. So could be alcohol use disorder, could be opioid use disorder, but it also could be any substance that they're struggling with for the IOP groups. Services also, we do counseling. Part of our Symetria Method that we call it involves access to unlimited therapy. It's something we take very seriously. Access to psychotherapy. So groups, individuals, psychiatrists, again, trying to really have a well-rounded approach.
Yeah, it certainly sounds that way. It seems like you're offering such a, like you said, holistic approach. And do you work with other agencies as well? Say if someone needs help with housing or anything along those lines, you can refer them on to other services?
It's a great question, and short, and yeah, the answer is yes. And one of the things, just speaking candidly, is so I've been here about nearly 3 years, and I've watched the clinic grow to where our clinic was, when I started, it was myself and a nurse, and then we had a doctor here just really just a few hours a week. We were small. We had a really, really, really small census at that time, but we knew growth was coming because just various factors, some positive like taking insurance, some negative like the fentanyl crisis that's going on. So growth, as it's exploded, we've been able to really offer just a lot more breadth to what we can do. Obviously, having a full staff. One of that is that we've got a dedicated team that works for all the clinics that does nothing other than referrals. So they do. So I've got a patient that comes in today and they're struggling with housing. Now I've worked in this community a while. I might have my own resources to link them up with, but if I don't, I've got someone I can go to in real time and say, this is what I need. And his job is to make that happen, whether it be housing, whether it be other healthcare needs. Sometimes there might be a more acute psych need, even beyond what our capability is. Someone with some real intense needs. A lot of our patients, unfortunately, through the addiction, might have some issues with STIs, STDs. So we've got community partners in that area. We know that things like patients who might come to us, they're pregnant, they need resources, or justice-involved individuals. So we definitely, when it comes to referrals, we've got a real good system in place to try to link people with appropriate resources.
Goodness me! So someone's going through, say the criminal justice system. You can help refer them to experts to help them through that long, drawn out, horrible process as well.
Yeah, absolutely. And I don't know I wish I knew what our data is right now in terms of percentage of patients who are, have some involvement with the justice system. I would guess though it's probably around 20%. I would think. I mean, maybe a little lower than that, but I mean it's a good that for some. I mean that is what the impetus for treatment. I mean,
absolutely.
To answer your question, yeah, absolutely. Something that I really feel strongly about some of the work that we do is in that ability to help someone meet those needs, to get people, housing is, when you reference housing, I mean, we know that is the number one need for someone who's going through treatment. What is going to be, statistically number one ancillary need? Housing. I mean, it's not even close. But what are the needs beyond that?
So you said, 4 years ago, it was just yourself and a couple of your team members, and now you've grown to such an extent that you're offering such a broad range of services and referrals as well. So that's really impressive. And as the program director That's down to what the great work that you've done and the commitment that you've got as well. And obviously the organization you work for as well is very keen to, get these services moving, because there's such a need now around
Yeah,
the whole approach.
it is. And I mean, I appreciate the kind words, the positive feedback. And I mean, we do really have fantastic support. I mean, just frankly, I've been really fortunate to work in some really amazing settings. And I think part of why I've been able to advance in the field is getting some great
Mm-hmm.
experience. That said, I've never been at an agency or with a company with the support at the level that we have here at Symetria. It's allowed us to grow.
Mm-hmm.
I mean, on a personal level, I mean, this is my community. I grew up here. I went to high school here. My family is in this community. So, I mean, I say I live, work, and recover in this community.
Mm-hmm.
And that means a lot to me.
Definitely, most definitely. So, how do you receive referrals from outside agencies? Do you ever work with, say, you mentioned the justice system? Do you ever speak to parole officers or even the police, or do you get referrals from external agencies?
Yeah, absolutely. So, a couple different ways. So, with people that are on probation,
Mm.
um, specifically like in the county we're in Denton County, we might get a referral from the adult probation department, especially as we try to build the relationships with them to let them know that if it's somebody who is struggling with opioid use disorder,
Mm.
we're probably going to be a better option than a clinic, than referring them out somewhere that is abstinence based. I mean, we know the statistics bear out that medication assisted treatment is more likely to be effective. Now, something that's really cool that we're doing, and it hasn't yet gone into effect at our clinic, but at some of our other Symetria clinics, where we're actually working with the local jails to provide medication assisted treatment to incarcerated individuals. And that is something that if you had told me, when I started here that was on the table,
Mm-hmm.
it would have blown my mind.
Mm-hmm.
But again, we're while we have not yet rolled that out officially in our clinic,
Mm-hmm.
it's something we're working on, but it is in effect in real time at some of our other clinics. And that,
That's huge.
um, we know that historically, our incarcerated individuals do not have access typically to a lot of life saving medications. And if we can help continue that treatment,
Mm.
that's something that is really matters to me.
Mm-hmm. So, your service in the future will be maybe going into the jails to actually do this and to train
Yeah, I
staff.
mean, transparently, we are part of what I'm doing is trying to effectuate
Mm-hmm.
something like that in the local community.
Mm-hmm.
It is not, again, it's not yet been implemented, but it is actively something we're actively seeking to do,
Wow.
and hoping, fingers crossed, that it could be something that is rolled out next year.
Oh, completely. That sounds to me very progressive, and it's nice to hear this, speaking to a professional like yourself that's actually engaging with the jails as well to get this in there, because it's so badly needed.
I, Chris, I'm with you. I've been I've had some conversations with some individuals in that setting,
Mm.
jail health,
Yep.
correctional health, and trying to make that happen. And it's one of the places where in one of those recent conversations where I was there, I went to physically, to the jail,
Mhm.
and having that conversation, chills, like really truly, like, not exaggeration, just thinking about if we could help individuals behind these walls,
Mhm.
just what that would mean.
Yeah, that's huge. Well, I wish you all the very best for that, and maybe we can have you on again when this is rolled out, because that's a really exciting program that you're planning there. So, and it's much needed. It really
Yeah, I
is.
agree. Thank
It
you.
really
Yeah.
is. Um, Aaron, with your location in Texas, can you tell us about the opioid crisis within your state and how it's affecting your whole community? This is a big
Yeah.
thing.
Yeah, I mean, it's at this point. I mean, the numbers are dire. I mean, in terms of overdoses doubling, annually over the past 10
Yeah.
years. We're over 200,000. The numbers are mortifying. What I can say is that okay, we're in the suburbs, right?
Yep.
And it what we see, because I know if it's as bad as it is here,
Mm.
then my experience in this field tells me that it's going to be even that much more worse in urban and rural areas, our underserved areas. And it's bad. That I live, work, and recover in this community, have a family here, and unfortunately have seen, in the school district where my son is at, recent fatal overdose, and it's like if it's happening here, again, we know where else it's happening. That's happening everywhere. I've seen some data that says that we've hit like that the numbers for 2024 might actually show where that overdoses maybe had actually hit, whether it be a decrease in 2024 or at least not an increase.
Right.
But they're still dire. Now, I mean, even if that's the case, it's not these are not going to be pretty numbers that come out. But there is some optimism that we might have peaked in terms of looking at the overdose numbers.
Do you think that because maybe the message is finally getting out about the huge risk now involved? I mean, my next question is going to be, would you say drug use has become even more of a risk than it was, say, 10 years ago? And clearly it has. I mean, just hearing what you're telling me now.
Yeah, I mean, it's so if you think about it, so one of the areas where, I mean, is it more risk than 10 years ago? Absolutely. No. If you had me on and you were just talking about alcohol, we'd be having a different conversation, because the data bears out that if I looked at where we're at now, say with teenage, adolescent, young adults, the numbers are dramatically reduced in terms of drinking where they were 10 and 20 years ago. And that's largely is the efforts that have been made in prevention, recovery, treatment, and really that getting the message out. Unfortunately, the reality is, though, from a global or a larger perspective, people are going to use substances. People are going to have maladaptive coping skills. I look at myself, and you ask me, if you said, why did you start using, or why do you use? And I didn't realize it at the time, but the short answer was to tune out the noise, to make that whatever it was, that anxiety, that trouble in my head, just stop, just quiet it. And so, I think that, to me, that's very normal, very common in talking with other people that started using substances at a young age. So they're going to find something. So whether it's more dangerous now, because, okay, so alcohol, we got the message out on alcohol. Kids, good luck. It's not going to be a 16-year-old today is not going to be able to go and buy alcohol. Unfortunately, what's scary is they're going to be able to go get fentanyl. And so it's lethal.
Yeah. That is heartbreaking to hear when you speak about it in those terms of young people. So young people are actually overdosing as well with fentanyl in your state as well.
Yeah. I mean, the rates. I wish I had I don't have anything right in front of me, but the data on fatal non-accidental overdoses aged 12 to 17 is mortifying. I mean, it has gone. If you look at it through, we've charted nationally. We've charted the overdose data on a national level since at least 1980. You see, say during the peak of the war on drugs in the 80s, there was an increase, but things started going through just, and on this decade compared to where they were, it's very scary. With the youth, while on the one hand you look and say, okay, well, teenage drinking is down dramatically. Well, unfortunately, I mean, they're going to turn to something, and what is the most readily available right now? It's fentanyl.
Yeah. I mean, on these podcasts, Aaron, I've heard a couple of people telling me that even cannabis, marijuana has got fentanyl in it, and that to me was just I couldn't believe what I was hearing.
I mean, we've not necessarily had an experience in our own community. I've read some stories of other communities of overdoses related to legal cannabis that was laced with fentanyl. Because you think, on a global picture, I view, cannabis deregulation as one of the positive steps in harm reduction and moving away from the war on drugs. But if on the other end, if you're telling me that cannabis is going to be laced with fentanyl, that's a scary thought. I mean, it's in, they say it's in everything. I know that, just again, if I speak from our community, our clinic, somebody comes in, they're using illicit drugs that they bought off the streets. The chances are at this point, it is laced with fentanyl. I mean, clinics like this are the front lines in the the fentanyl epidemic, fentanyl crisis.
Most definitely, most definitely. And this is why, this is one of the reasons why I'm doing this podcast, because I feel that people need to hear your side and what is really going on here.
Yeah, I mean, I'm glad that makes me, it's needed. Things like, the more we talk about this, I know, again, it's working in this field, living in the suburbs, having, kid, and you have these conversations. What do you do for a living? And inevitably, when I answer that question, it's people have a lot of thoughts. And what I find is there's still, while we have got the word out, there's still a lot of misinformation, a lot of lack of information. So having these conversations and getting that word out it's vital.
Yeah. Would you say social media has had a big part to play in this as well, around fulsome information, around, possibly propaganda or denial that this is even going on? I've seen that many posts about that as well.
I think so. I think, on the one hand, social media can obviously be a benefit, and can, in a positive sense of fighting, this, but unfortunately, the ability to spread misinformation in a rapid manner with a large audience is an aspect of social media.
Yep, most definitely, Aaron. My next question is, I ask this of all my guests, Aaron. I doing these podcasts, I get a very different answers to this, which is why I'm asking. What are your views on harm reduction and why it's so important for the awesome work that you're doing?
So I look at it like this. I believe in harm reduction, and I view it from this really bottom line, the term any positive change. For far too long. And because, my recovery primarily came through 12-step or abstinence-based. So I absolutely believe in that, and that for a lot of people worked for me. But too often, because 12-step has dominated recovery treatment forever, essentially, and so much of treatment is tied with that abstinence-based model, we lose sight and we look at anything short of abstinence as being a failure. Right. And it's not. Any positive change, any reduction in use is a step in the right direction. Anywhere if we can't keep someone alive, how can we treat them?
That's right.
So you'd say harm reduction, you can get me going. Very much believe in it. Our agency, I will, since we're talking about Symetria, how much do we believe in it? We had the author Maia Szalavitz, who's a New York Times bestselling author. I get a little chilly just thinking about her. We had her last month. She did a presentation for all of our clinics. So we had her live at Symetria, where all our staff stopped down to listen to the presentation. 2 hours with Maia. And she's just, she's done so much work in harm reduction. And I think, if what does Symetria believe when it comes to harm reduction, and do they believe in it? Well, if you're going to stop down your entire company for 2 hours to meet with, one of the real leading figures in the harm reduction movement, that is what, where we're at as an organization.
Yeah. That must have been very inspiring to have had 2 hours with her. That's incredible.
Oh my God. Yeah, absolutely. Yeah,
definitely. Most definitely. Last couple of questions, Aaron. What plans for the future do you and your team have at your service? Obviously, you mentioned the amazing work that you're going to be doing in jails. Is there anything else going on that you maybe got planned for next year? Or
I think one is just to try to continue to right now is do what I'm going to say, for like a better way to put it, is do what we've been doing and make sure that we are meeting the needs of patients. Make sure that our staff grows accordingly. We're always, of course, looking at the possibility of offering more services, like referencing the possibility of jail services, possibility of expansion of hours, of group programming, things of that nature. Anything we can do to decrease barriers to treatment and increase access. But in terms of anything specific, I feel like right now where we're at in our growth, it really is a matter of just sort of just fine tuning what we're doing and making sure that we've got the capacity to treat the people that are in our clinic versus reinventing the wheel or anything like that.
Yep, most definitely. Last question, Aaron. Have you a message for anyone who's listened to this podcast today who is going through addiction?
Yeah, I mean, one is just that there is hope. I try, myself, it's part of why I am very open about my own recovery. I can say that, I've both, in my own personal recovery, experienced some real hardships as a course of the use. And certainly I was at a point where I felt like I'm not just someone I can't just walk into a meeting and get help. I can't just walk into a treatment center. Like I've moved past that. I've tried that. That didn't work. And unfortunately now my life's got to where that wasn't true, but these are natural things we tell ourselves. Yeah. Fortunately, the things worked out in my life where, eventually those messages click. So one thing I would say is to someone who has had some experience in recovery and maybe it hasn't gone well, or they had a little bit of success and then had a setback. That's a normal part of recovery. I didn't know it at the time. I mean, I'd been trying to recover for about 3-4 years at the time where where it really, I didn't view it that way. I viewed it differently. But not to view, we too often view anything, again, short of abstinence as failure. So to someone who maybe has had that experience, that there is hope. Support is such a key to loved ones. You hear this, but how important it is to try to provide that support, but walk that line between, non-judgmental and non-punitive. And I understand we don't want to enable people, but we throw that word around like it's a bad thing. And sometimes enabling, it's really just loving someone. And I don't think you can love an addict too much. You can maybe make some poor choices involved in that, but loving them is never going to be a bad thing. So just, the message is just hope is out there and to never give up.
That was beautiful. Thank you, Aaron. Lastly, can you tell our listeners how to best contact you and to find your service online?
Yeah. So, a couple ways. One, we have like a, 800 number. It's 866-583-5844. That's available 24 hours a day. If someone called that number, they'll get connected with a member of our admissions team. As well as if they go online, symetriarecovery.com. The website's very user friendly. It's just going to pull up essentially our clinics. You click on essentially the clinic you'd be looking for, and it's very, very user friendly. So someone who maybe doesn't want to get it. Like I've been a person not wanting to pick up the phone. You can get everything started just, through the website as well. So we try to make it as simple as possible. And we're really good at our clinics about getting someone in as quick for help. Our admissions team are also just very compassionate individuals. So sometimes, it might not be, that phone call might not end up with you, even making that decision for treatment, but it might be the voice at the end of the other line that you needed to hear, just offering support.
Yep. Aaron, thank you so much for your time today, and please send my very best wishes to your awesome team. And what you've built is quite incredible, and it's been a real honor to have you speak to me today. And I look forward to having you on again, because I'd love to hear more about the prison program if that works. I'm sure it will, because it's much needed.
Right, yeah. I appreciate you having me on. I really like talking with you, and definitely once we get that going, I would love to talk to you about it.
Awesome. Well, thanks a lot, Aaron.
You're welcome.
Much appreciated.